Hi, I'm Dr. Marilyn Stoner, Associate Professor of Nursing at California State University. You're about to watch a student-produced video. In this video, students have been practicing the skills of literature search, analyzing evidence, and coming up with their own ideas for changes in practice. I know you'll be impressed with the student work, and should you have any questions or comments, you can respond here on my YouTube channel or email me at mstoner@csusb.edu. The California State University San Bernardino website is nursing.csusb.edu. Thank you for watching.
As future nurses, we know that nurses never cease to learn something new to help increase the well-being of their patients. The intensive care unit is known as one of the most stressful environments within the hospital. Patients in the ICU are already immunocompromised and are receiving multiple medications that often produce common side effects, such as nausea and vomiting, constipation, diarrhea, headache, and lethargy. But what if there was a way to reduce the use of these medications to try and minimize these side effects? That's where music therapy comes in. Music is a non-invasive, inexpensive intervention that serves as a powerful stimulus that can affect a person's mood and trigger feelings. In recent studies, music has shown to decrease pain, stress, and anxiety levels of patients in the ICU setting. Our patient is Mr. Sar, a 68-year-old Asian male who came in with the complaint of shortness of breath. He is currently suffering from end-stage lung cancer. Chemotherapy and radiation have been unsuccessful. The scene opens with the family coming in to visit Mr. Sar. The family is encouraged by the nurse to use music therapy as a comfort measure in union with his medical treatment to try and help reduce his pain and anxiety levels while in the ICU. Mr. Sar is currently on a ventilator to help assist him in breathing and increase his O2 sats. He is also on multiple vasopressors to help maintain his blood pressure and is on propofol for sedation. His current vital signs are blood pressure of 148/89, heart rate of 116, respiratory rate of 16, and O2 sat of 99%. His pain level based on the FLAC scale is a 5 out of 10.
Good morning. My name is Rosa. I'm the nurse for Mr. Chang. Do you mind giving the patient's family member?
Yes, we are. This is my mom, my brother, then that's my dad.
Nice to meet you.
Nice to meet you. I can see my dad is breathing easier today because it has the ventilator on. But as I look at the monitor, I'm kind of concerned about his vital sign right now. They don't look normal to me. I know that cancer patients, they're in a lot of pain.
Well, he seems to be doing a lot better today. His pain levels are decreased since he was admitted, and his blood pressure is a little elevated, but it's been improving since then, and the ventilator is helping him breathe better. So he's doing better.
Oh, how do you know he's not in pain if he can't talk? I was wondering what else can he do to make him feel better and more comfortable? I feel like he's still in a lot of pain.
Okay. We use a measuring scale called FLAC, and what we do is we assess the patient's facial expression, his leg and body activity, and see how comfortable he looks. So he seems to be doing a lot better.
Is there anything that we can do to make him feel better? He doesn't seem fully at rest.
We're doing the best we can to make him comfortable and free of pain as possible. So.
Yeah, it seems really noisy right now. There's a lot of beeping going on and the room's really bright. Is there anything that we can do to make him feel more at peace?
I can lower the lights for you, and there is the option of music as therapy.
Music therapy? What do you mean music therapy? I've never heard that before. Can you explain that?
Music therapy is a form of relaxation technique and is known to reduce anxiety and stress in patients. There's a lot of different types of music therapy, but for Mr. Sack, we can use just have him listen to his favorite songs. Is that something that you might be of interest to you?
Yeah. That sounds good.
That sounds great. Since he's sedated, do you think he can still hear the music?
Yes, he can hear. He's sedated, but he can hear you guys.
That sounds like a good idea, but does it really work?
Yeah, studies have shown that it's helpful.
It doesn't hurt to try. We'll try it. If it doesn't work, we'll stop it. And we'll bring his favorite music in.
Yeah, we could
to
bring
listen.
something relaxing. My dad likes to listen to a lot of piano and instrumental songs.
Yeah, that's true. My dad likes to play piano, and actually I have a CD in my car. I can go and get it, so then we can play the CD in a room, and he can listen to.
Alright, I'll be glad to set up the room with you. Let me just run it through the charge nurse and we'll come back and set the music.
Okay, thank you so
Thank you.
much.
No problem. Hey Cathy, I'd like to try some music therapy as an intervention for Mr. Sar to help decrease heart rate and pain and anxiety. Is that okay?
Music therapy? Why music therapy? I mean, have you read any journals that say that music therapy improves the outcomes of ICU patients?
I have. They describe research studies where patients listen to at least 30 minutes of music a day, and it supports that the use of music therapy has a collaborative intervention to reduce anxiety and stress and also promote healing.
Well, what about his pharmacologic interventions?
Well, his medications is helping, but I'd like to try this also.
Okay. Well, my other concern is that he's on a ventilator. Have you read anything that was ventilator specific?
Actually, I did. These studies supported that music therapy helped decrease heart rate, pain, anxiety, and patients require less medication.
Okay. Actually, that sounds good. Let's go ahead and I'll go with you.
Okay, thanks.
Hi, my name is Cathy. I'm going to be the charge nurse. I understand that we're using music therapy for Mr. Sar today.
Yes.
Is there anything specific that you guys want to play?
Yeah, I have a CD right here. Can we use this?
Yeah,
This is
sure.
his favorite song.
Okay.
Hi honey, we're gonna play your favorite music for you, so you can get better, okay?
Mr. Sar has been receiving music therapy for 30 minutes a day for 1 week now. During a family visit, the family notices an improvement in his vital signs and a decrease in his anxiety levels.
I can see how music can relax him and is masking the hospital noise, and this will help him sleep deeper.
Oh look, at the monitor, the heart rate and the blood pressure went down, and he looks less anxious. That is good.
Hey Dad, I hope you like the music we played for you.
Hi Rosa, I just wanted to say good call with the music therapy because with it we were able to decrease his pain medications and the vasopressors that he used. And the family actually wants to implement music therapy for the rest of his hospital stay.
Okay,
So good job, and I'm actually going to bring that up in the next staff meeting.
that sounds good.
All right, thank you.
No problem.